Does turmeric help lower inflammation? And by the way, since we're talking about whether it lowers inflammation or not, let's also talk about some of the other claims that there are about turmeric, that it may help with memory, or that it may help with bones and joints, maybe along the inflammation route, that it helps with upper respiratory conditions or even with skin stuff, There's actually a lot of claims about what turmeric can do for the body, but does it actually do these things? We are talking about turmeric today, guys. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I'm so glad that you're with me. This is one that's really important because actually I see ads for turmeric all over the place. I see commercials on TV. I see supplements in the CVS and in the stores. And I see a lot of patients asking me about this. And I think turmeric is actually a very interesting ingredient. During my reading, I was like, wow, this is so interesting. Basically, it's a plant that's in the ginger family. And that kind of makes sense, right? Because it is actually an ingredient that's used in curry. So it's kind of got that spice to it. So it sort of makes sense. The underground stem of the turmeric is used as a spice in cooking and in traditional medicine as well, which is also very interesting. It's been traditionally used in Southeast Asia, but in other countries as well. Your Chinese medicine, traditional Chinese medicine as well, which is so interesting. And according to the NIH, in India, traditionally it's been used for disorders of the skin, the upper respiratory tract, joints, digestive system, you name it. So a lot of different things. So that's the thing, right? We see that it has historical roots, no pun intended. But nowadays we see turmeric that's being marketed and advertised as something that you can take to help lower inflammation. I've seen that, to help with arthritis, digestion, respiratory issues, allergies even, by the way, liver disease, depression, memory. By the way, write in the comments what you've seen turmeric advertised for. Also, let me know if you take turmeric and what you take it for. So this is the thing. The other thing I learned about it, by the way, and I'm going to get to whether it actually lowers inflammation in particular and some of these other things. So also I learned about curcumin, which is a component of turmeric, and sort of the thing that we think may give turmeric its sort of activity, right? It's sort of, oomph. Also, apparently, curcumin is what gives turmeric its yellow color. And apparently it stains too, like on your clothes, if you get it on your clothes. Didn't know that. But anyway, so people are using turmeric as a supplement. Sometimes people are taking it as a pill or a supplement. Sometimes people are using it in like smoothies or things like that. I mean, shoot, you can cook with turmeric, right? So some people are just cooking with it. But the question is, should you be taking it for additional reasons, like to lower inflammation, to help with memory, to do some of these other things? So there has been research done about turmeric. That is for sure. But the question is, has this research told us definitively what turmeric does and what it doesn't? And that is the thing that's in question, all right? So remember, how well of a conclusion we can draw from a study really depends on a number of things, including how good that study was, how well done and how well performed that study was, et cetera, et cetera. So my point being to saying all this is that, turmeric, among other supplements and things, has been tough to study for a number of reasons. Number one, turmeric is not always absorbed in adequate amounts into the bloodstream. So that actually could be sort of a confounding factor for why it can be hard to study it. This is when it's taken orally, by the way. Also, there's other characteristics, different amounts of turmeric in different supplements and different sort of lots and things like that. So inconsistency between products and stuff can make it difficult to study. There are other reasons why supplements, including turmeric, can be hard to study. So you're saying, I know you're like, so what's the bottom line, Dr. Jen? Does it decrease inflammation and do all this stuff or does it not? This is the thing. I would not be surprised at all if turmeric has biologic effects and has multiple biologic effects. That would not surprise me at all. But the question is, what are they and to what effect does turmeric act on them? And that's what we don't have a lot of information about because we don't have a lot of great studies about it. So I know you're saying, so what am I supposed to do then? Do I take the supplement? Do I not? Well, rest assured that the NIH, among other organizations, the NIH is funding research on turmeric. So hopefully we'll learn more. Hopefully studies in the future will tell us more. Turmeric may not have, in terms of taking a supplement, may not have many side effects. However, I always say this about supplements, any and every supplement, you got to talk to your doctor before you take anything, because if you're on blood thinners, if you're on medications for this or that or this or that, there might be interactions, right? So what you got to do is, if you're interested in taking turmeric, you got to go to your doctor and say, hey, I'd like to start taking this, or I have been taking this. Let your doctor let you know if it's okay to keep doing it or to start, to see if you do develop any benefits or get benefits from it. In terms of the formal verdict about turmeric and if it sort of decreases inflammation and helps with all these other things, we need to wait for more data. But will it cause harm? For many people, it may not. You do need to talk to your doctor, though, to find out if you fall into that category. So, like I said, let me know if you take turmeric, if you've thought about it, what you're taking it for, etc. I would love to know. And if nothing else, it sounds like it's great in cooking. So, that's a good thing. Curry is good, right? Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Please subscribe to my channel on YouTube. Also, consider clicking the little bell for updates. Guys, I'm Dr. Jen. I'll see you soon.